Welcome everyone to this video on group therapy or group learning. This presentation is particularly emphasizing on transactional analysis methodology for group therapy. This video is intended for advanced learners and is designed with experiential exercises. So the length of time may be more than what is shown on the video time if you do all the exercises. For best learning experiences, please do all the exercises. At the end of listening to this video, you will be able to define group therapy. You will be able to list the characteristics of group therapy. You will be able to identify the different types of group therapy. You will be able to list the foundations and therapeutic factors in group therapy. You will be able to list the characteristics and recommendations of Eric Berne for the group therapy. Group therapy is defined by the American Psychiatric Association dictionary as a treatment of psychological problems in which two or more participants interact with each other on both or emotional and a cognitive level in the presence of one or more therapists who serve as catalysts, facilitators, and interpreters of the therapeutic activity. The same APA dictionary defines individual therapy as treatment of psychological problems that is conducted on a one-to-one basis. One therapist sees one client at a time, tailoring the process to his or her unique needs in the exploration of contributory factors and alleviation of symptoms of the problem. Group therapy may be classified into different types depending on the following characteristics. 1. Location where therapy takes place. 2. The approach to therapy. 3. On the kinds of issues that are being addressed in the therapy. 4. Outcome objectives of the group and even techniques used may be used as a method for classification. Now let's see which are the kinds of group therapy methods based on the location. When group therapy is done in private practice, it is one kind. When group therapy is done in hospital practice, group therapy may be done in a mental health care center, and group therapy can also be done in community centers. According to the approach to the therapy, there are different kinds of groups where therapy is practiced individually in the group, therapy practiced treating the group as one entity, and therapy can also be conducted as interpersonal group therapy. Based on the objectives of outcome of therapy, the methods of therapy groups can be again grouped into cognitive behavioral groups, psychoeducational groups, interpersonal groups, skills development groups, support groups, and the like. Whatever may be the types of group therapy or the varieties in which group therapy is conducted, the foundations of effectiveness of group therapy are based on certain principles. They are the three levels of the inner life of individuals, basically the intrapsychic level or the personal level, the interpersonal level or the relational level, and the socio-psychological level or the group level, inner life of the persons. Yalom, in his book on Principles and Practice of Group Psychotherapy, identifies the following as the factors that play in the effectiveness of group therapy. Universality. Patients realize that others exist who share similar thoughts, feelings, and issues. Altruism. Patients can improve their self-concept by assisting other patients while working in the group. Installation of hope. Patients benefit from witnessing the success of other group members and can envision themselves following a similar path. Imparting information. Patients gain knowledge and information from both the group members and the group provider or the leader. Corrective recapitulation of primary family experiences. Patients can benefit from the opportunity to properly recreate family experience in the controlled environment of group. Development of socialization techniques. Patients learn effective and proper ways to interact with others while getting treated in a group. Coming to more on Yalom's therapeutic factors. Imitating behavior. Patients gain new insight and understanding through the observation of other group members. Cohesiveness. Patients experience like one group when the feelings of support, trust and belonging to one another is generated in the group. Existential factors. Patients realize that they are responsible for their life decisions. Catharsis. Patients share personal experiences from both past and present in the group. Interpersonal learning. Patients gain an understanding of their interpersonal impact via feedback received from other members, and as well as they get to create an environment for one another to learn. Self-understanding. Patients understand the covert factors that influence their behavior and emotions. Now stop this video and do this exercise. Reflect and write from your current knowledge and experience. What is the definition of group therapy? What is the foundations of group therapy? What are the therapeutic factors according to Yalom for the beneficial effects of the group therapy? After you finish, continue with the rest of the video. These are the essential principles for conducting group therapy according to Byrne. Psychotherapy group is a sedentary but social group of adults according to him. Sedentary because the members of the group are expected to sit on their chairs. Members of a treatment group must be properly prepared in prior individual sessions, at least one, and preferably randomly allocated to groups. New patients may be added after proper prior preparation in any group. Comfortable location with physically comfortable seating and equipments like board and pen for writing are essential. Meeting must be regular in time and place as planned earlier. Byrne also gives essential methodological guidelines on conducting the TA group therapy. The first and the most important of them is the clear administrative contract on fees, timing, and topics discussed. Byrne suggests that any topic could be discussed as part of the group therapy method. Treatment contracts must be decided for each of the client as per the first interview. Therapists should have clear goals based on the contracts with each of the patient, and the therapist is also recommended to aim to learn something from each session of the group therapy. Analysis of transactions or breaking down complex transactions into simpler ones is the core technique in TA group therapy. Other techniques may be adopted if absolutely essential. Individual sessions for clients outside of the group sessions may be incorporated if the therapist thinks it is absolutely essential for the client. When Byrne advocates group therapy as the TA method, he is explicit about the responsibilities of the therapist. Here are some of the responsibilities of the therapist that he has listed. It's very important that the therapist take care of his own physical and psychological health. For this, supervision, administrative and psychological are essential. The basic principles of any treatment to be mindful in psychotherapy also are listed like this. Do no harm to the patient by way of your therapeutic methods. Remember that patient has built-in drive to heal, and when therapists treat, it is God that cures. Byrne gives specific guidelines how the therapist may relate to the clients in his characteristic way. 3 self-reflective questions for therapists recommended by Byrne are: why am I here? Why are the patients here? Why did the patients choose me from among all other therapists available? And the 3 qualities for the therapist that Byrne suggests are: observation, that is using all the senses, not just seeing, sight, hearing, taste, smell, and touch. All the therapist senses must be alert. Equanimity in approach and initiative in activity are the recommended qualities. Continuing with the guidelines on therapeutic relationship, Byrne recommends a therapeutic demeanor for the therapist that should be natural, courteous, alert, interested in the clients, and enthusiastic in activity. His recommended therapeutic approaches should be aesthetic, well groomed and well dressed. The therapist should look graceful, and the therapist should have responsibility to self and others. And the therapist is invited to be committed to the therapeutic work. Going through his book on principles of treatment will give you a detailed description of what he means by each of this. Byrne, with his astute clinical skills and large professional experience behind him, has listed some of the challenges that a therapist face in group therapy as recommended by him. The fact that the therapist's idiosyncrasies are exposed to the clients is one of the important challenges. So the therapist needs to maintain mindfulness about it. The existing social and institutionalized concepts, which are part of the reasons for the patient's problems that brought them there, are also challenges to the therapist when he initiates a novel way of treating in the group. Negotiating a bilateral contracting, taking into the clients into trust and as equal persons with him is another important challenge that the therapists face. Having a balance between a personal and a professional interest in the patient is also challenging. Having a balance between authenticity and a professional poker face while working with the clients is a moment by moment experience challenge to the therapist. Now it's time for another exercise. Please stop the video and please find the answers to these questions. You can go back and listen if you think you need to. What are the principles of group therapy according to Byrne? What are the methods in TA group therapy? What are the therapist's responsibility to the group in group therapy? What are the major components of therapeutic relationship? What are the therapist's challenges in group therapy? How is group therapy different from group learning of group therapy? How is group therapy different from TA-based one-to-one therapy? Thank you everyone for listening to this video. I'm sure it has helped you get a clarity on what group therapy is and how is it different from learning about group therapy in a group. Please go back and listen to the video if you think you need to as many times as you want. Thank you again.